Hi guys, it's Kazi introduction time now. I had no idea how to introduce this topic. One, because I don't think it's physically possible to make any kind of joke about this topic, but I will try. And I searched up appropriate eating disorder jokes. So me and Gule are going to get cancelled 4 episodes in. Okay, so what I got is okay. Don't leave, please. Okay, so this is the thing.
Kazi, please don't.
I have to. It has to be done. I have to start off with a horrendous joke that will make 45% of the people leave.
I apologize in advance for the 3 people watching this.
The 4 people watching the podcast right now. It goes something like this. My brother has a beef eating disorder and I'm worried. Kulayu follows up with, oh, why are you worried?
Oh, why are you worried?
His life is at stake.
Kazi, no! They've already left. Who are we going to talk to now?
In our defense, I could have made that worse. I literally searched up appropriate eating disorder jokes.
I mean, you have to appreciate the effort here.
Right?
Yeah.
I mean, is there any other joke we can make where we're not going to get cancelled, Gule?
I don't think so.
I don't think it's possible.
I think that was a good job, Kazi.
I think it works. Mm-hmm. I think the intention of that joke was to... I'm not sure, actually, Gule. They could cancel us.
Mm-hmm. That makes sense.
Anyway, so in this episode, we're going to be talking about eating disorders. We're going to be talking about symptoms. We're going to be talking about the different types of eating disorders. We're going to be talking about some of the myths associated with eating disorders. We're going to be talking about what you can do as a friend to support someone who has an eating disorder, what you can do as anyone with someone in your life who has an eating disorder, and try to support them.
Assuming any of you are still there after Kazi's very good joke.
It was an okay joke.
But, okay. So I want to start off with, there are multiple types of eating disorders, but we're going to talk mainly about 3 of them: anorexia, bulimia, and binge eating. These are the most common types of eating disorders. Anorexia is basically when you could say, morbidly underweight, and it involves self-starvation. When you restrict your dieting, you exercise a lot to lose weight when you're already really underweight. And there are 2 types of anorexia. There's restrictive anorexia and there's purging anorexia. It's similar to bulimia because bulimia is when you eat but you puke it out every time after a meal. And the difference between them is that you don't need to be underweight to be diagnosed with bulimia, but you have to be morbidly underweight to be diagnosed with anorexia. And a lot of problems can come from being morbidly underweight in anorexia, of course, because you're not taking, your body is not taking the amount of nutrients and vitamins that it needs to grow healthily. So you will experience a lot of hair loss, you will have dry skin, you will have brittle nails, weak bones, a weak immune system, problems with your kidneys. There will be, for women, your period might stop or may become irregular. So a lot of the problem with eating disorders is that there are a lot of health problems that come afterwards. So even if you recover or start your recovery from an eating disorder, you also need to take medication and go through recovery for all these health problems that come with it. For bulimia, as I said, you don't need to be underweight. You can be an average weight or slightly overweight. But the point is that after meals, maybe not after every meal,
you can even be obese.
Yeah.
For bulimia,
size. Yeah, you can be any size for bulimia, and it's basically that you purge out. And you can even develop calluses on your finger joints or behind your knuckles if you force yourself to puke out with your fingers. So, and then
how do the calluses form?
Because when you stick your fingers down your throat, it scrapes against your teeth when you're taking your fingers out.
Oh.
So it's one of the signs that a person has bulimia. If they do it excessively, they will form scars on the back of their hand.
Oh, yeah. I didn't know that.
Yeah.
You can look at
You could notice if the skin seems like it's peeling off a little bit, then that might be a sign. On top of noticing that a loved one is going to the bathroom after meals constantly or more than usual. So that's one way to look at it. And binge eating, the difference between binge eating and bulimia is that you eat, but you usually overeat. but you don't purge like in bulimia. In bulimia, if you overeat, you will purge. But in binge eating, it's more the opposite of anorexia and bulimia. Those are more starvation, and binge is more overeating and not taking it out. So usually someone who binge eats might eventually become overweight because they don't puke out the food or exercise excessively to get rid of the weight. It's like, and it's not because of, so a lot of people like to say that, you know, when they hear about eating disorder, like, why don't they just eat? Or why would they not eat? That's not, how is that supposed to make them pretty? Or how do they think that that's going to make them look nice? But it's usually, the thing that most people don't understand is that it's usually not about your appearance. It's almost never about your appearance. That does come in as a factor later on, but it doesn't start with that. It's basically just like an unhealthy coping mechanism for the things going on in their lives. So if some of us, to cope with our emotions, like write a diary or maybe talk to our friends or something, people with an eating disorder will feel comfort from not eating or from puking or from binge eating, like emotional eating. No,
it could be like really extreme body dysmorphia.
Yeah.
So it could be that too.
It could be that too. It depends. But it's not vanity. It's mistaken a lot for just vanity. And I watched this video, actually, a TED Talk about this girl who was struggling with anorexia. And she said that it also has a lot to do, for her at least, the experiences are obviously different because there are different reasons for why people develop an eating disorder. But how she described it was, for her, it was like this way of regaining control of her life. Because through her life experiences and stuff, she didn't feel like she had control over anything in her life. So how she coped was that she would restrict her food. She would make rules for how she could eat, because that was the only element in her life that she felt she could have complete control over. So whenever there was, and then when her family found out about her eating disorder, they tried to get her to eat more. Her first reaction was to restrict her food even more because she had lost control over her eating disorder now that her family was involved. So she restricted her diet more and she began losing weight even more because she wanted to regain that control that she felt had been snatched away from her. And
it doesn't just necessarily have to be that either. Like, I know there are cases of people who just do not enjoy the experience of eating. So it's another problem going on. So they don't like chewing or they don't like tasting and they just refuse to eat in a day.
Yeah. They're different. Everybody's experience is different. There are different reasons for everyone. And there's also, I read that most people with an eating disorder a lot of people with an eating disorder will describe another voice in their head that sounds a little different from themselves that tells them not to eat or what to eat or when to eat. And I haven't seen too much on it, but but it's like some of the explanations that were given was that everybody has a negative voice, and with an eating disorder that negative voice is just amplified to control how you eat and to make sure that the eating disorder stays alive.
Would you classify that as an auditory hallucination or just an inner voice though?
The way they describe it is not like an auditory hallucination though. It's more an intense inner voice that dictates what you do.
Where do you think that stems from though? Like societal pressure, peer pressure, where does that come from?
Well, it can come from, obviously societal pressure, peer pressure will all factor in, especially like in our society where you have to hear about weight in every other family gathering. The aunties will be like, "Bete, are you sure you should be eating that?" And you have to hear all of that, but it's also like your chances can be increased if someone in your family already has an eating disorder. And it also depends on your experiences in life, if you need to, like, as a coping mechanism. Or one of the factors that affect it, obviously, is body image. And there are multiple reasons for that. So you have the image of the Caucasian female model who is usually underweight. They probably weigh, like, between 45 to 50 kg or something. And every magazine... slim waist, thin arms, thin long legs. It's just perceived as it's the beauty standards. So and because of colonization and our history, we tend to look towards Western culture to see how we're supposed to improve or develop or how we're supposed to look, especially. You have even for like, for example, in African Americans, they have a history of their like fuller lips, or suppose a larger body will be perceived as ugly or not pleasant to look at. There was the culture of portraying them as large and not very clean, and like they don't take care of themselves, and we all buy into that, especially with the growing influence of social media. You have Snapchat filters and editing apps to make yourself look thinner, and like the perfect image. You look for the likes. You get more likes when you edit your image to look thinner, and it all just plays into how you decide to treat yourself and what you give more importance to. You do see a slight transition in the perfect image for a woman from being like really, really thin to being more thin waist and a curvy body. So people will try to get their waist as thin as possible, have implants, and just, again, the preoccupation with trying to get that perfect hourglass body, that perfect summer body, and all of that. It seems like the most important thing at the time, but it's really not, and that's hard for most of us to accept. I think everyone is concerned with how they look at some point in their lives, but it has dangerous consequences. There was this case of a model who died on the runway because she wasn't eating properly so that she could look perfect for her job. And even in Asia, there's a long history of shaming overweight people. There's people in Central Asia portrayed as very thin. There's even apparently K-pop doesn't let you audition unless you're a certain weight. So there's a lot of pressure from all sides. Even for men, of course, there is eating disorders are typically seen as only affecting females, and that's really, really, really not true. Men can have eating disorders as well. But there's been a transition recently from women finding more muscular men as attractive to seeing more thin men as attractive. Like Timothy Chalamet is a big example where if a guy is thin, automatically he is perceived to be more attractive. So that obviously has increased the pressure on men as well. And they have the additional there's obviously already a stigma associated with eating disorders, but being male, and because it's seen as not a very masculine disorder to have, even like someone in my family, when I was talking to them about eating disorders, they said, men don't really care about their appearance that much, so they can't really have eating disorders. And that's not true. One, because it's not always just about your appearance, and two, because eating disorders do not discriminate.
Another common experience that people have is an experience called coffee loading. So it's when you stop eating, but you just start substituting that food for coffee. So they'll have like 6 cups of coffee a day instead of eating food. And that can be quite harmful. First of all, coffee isn't very calorie intensive first, so you're not getting your calorie requirement, you're not even getting close to your calorie requirement. Second, if depending on the strength of the coffee you're drinking, so especially with something like this, which I would call a coffee dependency, we're becoming dependent on the caffeine inside the coffee and how strong the coffee is. You're transitioning from like a cappuccino to an espresso. What you're taking away is all the nutrients. So at least when you have a cappuccino, you have the milk, so you have something going into your body. But when you're just drinking plain black coffee, yes, black coffee in moderation can be good for you, but when you're only drinking black coffee all day, first of all, that much caffeine is not good for you. It's going to not only affect your body in a bad way, but it's going to affect your heart badly. Your heartbeat will go down, you'll suffer, you could even have a heart attack depending on the amount of coffee that you drink.
Yeah, exactly. And there was actually this TED Talk I was watching the other day where this guy was sharing his story about struggling with anorexia, and he also talked about coffee loading, and he talked about how it got so bad that, and he didn't know that he had an eating disorder, and because of coffee loading, his heart rate had gone down to 46 beats per minute, and he had to be taken to the hospital because At 40 beats per minute, it's medically known as heart block, which is basically like it's incompatible with life. So it is very dangerous and it's a very serious issue. Other than, I know we've talked about anorexia, bulimia, and binge eating disorders. These are the most common types of eating disorders. But there are also other types of eating disorders that have been recognized. So, for example, there's pica, I think that's how you pronounce it, which is basically an eating disorder where where the person they can eat regular food, but they will also eat unusual items. Like some people will eat dirt, grass, they will eat glass, and tissue juice maybe, paint. It can be various things, and it's usually, to be diagnosed, it usually has to go on for, I think, a month. And that obviously has a lot of side effects. You're consuming things that are not meant to be consumed, so they can cause problems with your organs.
You're eating glass. You don't really need to be a rocket science to put 2 and 2 together.
Yeah.
Glass not good. It could be life-threatening.
Yeah.
Cut your intestines, cut your stomach, probably cause a lot of discomfort based on the amount of glass you're eating. It could just mess up your whole body.
Yeah, because you're consuming stuff that you're not supposed to consume in the first place. It could even like accumulate in your stomach or something.
Yes.
Cause kidney problems.
Yeah, especially because if you're eating glass, that's not going to dissolve with your stomach acid.
Yeah.
So either it's just going to pass out if it's small enough shards of glass.
Mm-hmm.
I mean, if it passes out,
Yeah.
if it doesn't get stuck in your intestines. But if it's not small enough, it's just going to get stuck in your stomach, and you won't be able to pass anything out then.
Mm.
And then if you're eating dirt, eating dirt is interesting because as kids, most of us, I assume,
Have eaten dirt at some point.
At some point, and in the animal kingdom, it's really common for animals to eat like dirt and stuff and like mud and stuff. And even in animals, sometimes it's normal for babies to eat the excrements of their parents.
Mm.
And what that does is that it's transferring the healthy bacteria to your body. So children, that response is usually because children in those environments are eating mud, eating dirt and things so that they can build up those immunities. And then we see that those instincts usually transition away as we get older, but sometimes those instincts aren't going away. So it could come from the fact that we as children usually naturally we're inclined to eat certain things to build up our immunity, to make ourselves acclimatized to our environment. And then growing up, it could also be a very Freudian explanation of it is, if you're growing up and you're not receiving a lot of attention from your parents, and you're only receiving attention from your parents if you eat like glass, it could be your association is that people will only care about you, or people will only give you attention or care about you if you're in a dangerous situation. So it could be that you start eating glass when you want someone to give you attention.
True. It can also have it can also be associated with OCD though. So OCD is obsessive compulsive disorder, in which you have certain thoughts which are called obsessions, and you have certain actions which are called compulsions. These compulsions are basically they're enacted to rid yourself of the feeling that those thoughts or obsessions invoke in you. So like, for example, if you have an obsession that tells you that every surface around you is sticky, or like your skin is sticky, then your compulsion will be to wash your hands maybe 30 times a day, or like rub it raw because you constantly feel like there's something stuck to your skin. And the term OCD is used really loosely, like, oh, I have OCD because I need my wardrobe to be color coordinated or something like that. And while you may have OCD traits, it's not the same as saying that you have OCD, because it's actually a very debilitating disorder. Like some people who have OCD can spend 3 hours taking a shower, another 3 hours getting into their clothes. They can't like touch sticky surfaces sometimes, and it really affects the way that they can socialize. So anyways, a part of OCD could be having a disorder such as pica, where maybe you're upset. One of your compulsions could be to eat dirt or to eat paint or to eat glass. There's also rumination syndrome. This is a condition where you chew the food and then you spit it out. So without swallowing it and without digesting it, you chew the food and then you spit it out. And this is also dangerous because you're not taking in the nutrients that you're supposed to be taking in. You're tasting the food and then you're spitting it right back out. And this can also, again, this is more common in children and in people who might have a neurodevelopmental problem. There's also avoidant restrictive food intake disorder, more commonly known as ARFID. And in this, basically, it's restricting your food in terms of, like, you can say you stop eating foods that are high in carbohydrates. So you restrict yourself from an entire food group. Or it can also be that there are certain colors and textures of foods that you try to stay away from. So I watched this other video on this woman who said that she'd have to like separate all of her food components. She couldn't have like if it was a fruit salad or something like that, she had to separate all the components, and there were certain foods that she couldn't touch, like she felt disgusted touching. And if food touched the other food in any way, or if she thought that the foods touched, then she couldn't eat it. And obviously that's also really difficult to live with because you have to separate the foods, and you might be avoiding certain foods that you need to fulfill your calorie and nutrient requirement. And again, this can also be associated with some OCD. So these last three are actually they come in under a different category of eating disorders. They don't really have the same reasons necessarily or the same manifestations. And they're seen as more related to something like OCD or like an intellectual disability rather than how anorexia, bulimia, and binge eating disorders are taken as.
And there are lots of ways that we as loved ones can bring this up with a family member or a friend or someone we care about who we can see is suffering from one of these things. There are a lot of different ways we can talk to them, and unfortunately it's really difficult to know what is appropriate to say when. It's usually not when we talk to people who are suffering from an eating disorder, we usually never speak to them from a place of malice or a place of ill intention. It's human to say the wrong things sometimes, and it's okay to say the wrong things sometimes. It also depends on the person who you're talking to. There's a lot of advice that I know people who have eating disorders who will disagree with. There's certain advice that they think would be harmful to them, but there's also a point where the eating disorder is harming them so much. Is it more harmful for their eating disorder to continue or to be more forceful so that they're hurt by the forceful advice instead of just the eating disorder? So there's a balance there you need to keep of how much you accept them saying this doesn't make me feel good, but you know what actually isn't making them feel good in reality is the eating disorder. So, and then especially as a friend to know what your limits are when talking to someone, how forceful you can be with someone, and when is the point that you override the importance of how comfortable they feel as opposed to the eating disorder. So when is the point that you say you have to stop now, like I'm going to keep a watch on you, like this is just gone too far, I'm going to
call your parents?
Parents, or
it's difficult either way. It will always be difficult if you have to talk to someone you care about or just anyone about having an eating disorder, but there's no one right way to do it. It depends, like Kazi said, on the situation, but there can be like certain guidelines that you can follow in the sense that you shouldn't show any judgment. And your first impulse might be to say something like, "Oh, but you're already so pretty," or "But you're already thin. You don't need to lose any more weight." And your intentions might be good and everything, but that's actually not helpful because it kind of encourages their way of thinking. So saying that they shouldn't do what they're doing because they are already thin or beautiful is wrong, because you shouldn't be doing that anyway. Even if you don't have a great physical appearance, that should have nothing to do with it. So you're kind of feeding into their thinking that drives their disorder in the first place. So you should actually avoid using statements like that and just talk about the behavior that you're concerned about, just because it's bad for their health. However, your first utterance shouldn't be something like, why are you doing this to yourself? Do you not know what you're doing to yourself? I know you will usually mean well in those instances, but those kind of comments are not helpful. Someone with an eating disorder usually knows that what they're doing is harmful to them, but the underlying reason that they have the eating disorder will override that knowledge. So you can't talk to them from a place of judgment or from a place of anger. It's understandable that you will be hurting because of seeing someone you care about hurting themselves, but you need to understand that in this case, you need to put them first, and you need to be careful and think about how you're going to approach them about the topic rather than just spontaneously or just say it without thinking about what you're going to say. For instance, you should talk about it at there's never really a right time to talk about having an eating disorder, I guess. As soon as possible, obviously, but it shouldn't be after an outburst, maybe you guys have had a fight and you'll just say, oh, but you don't eat. That's not how you should bring it up. You should bring it up separately, talk to them separately, privately, so that they're slightly more comfortable in talking about it. And it's better to mention the habits that you've noticed that are concerning you. So say something like, I've noticed that you're not eating your favorite food anymore, or something like that. Or I've noticed the scars on your knuckles, are you okay, kind of thing. Instead of directly saying, are you starving yourself? It's like saying, do you know what you're doing to yourself, is not the right way to go about it. It doesn't help. It doesn't help to lecture. Obviously, that will be your first impulse, is to lecture them about how and why they should be eating. But when you bring up the topic of an eating disorder to someone, especially for the first time, you should be there more to listen and to understand. So after you say, are you okay? And you slowly get them to open up, you should try to listen more than speak or lecture, because it will be very difficult for them to talk about the experience, and it will help them more to know that you need to be there and show them that you support them and that you're there for them and that you care about them. You should always suggest seeking professional help, because for an eating disorder, it's not just as simple as start eating. It's unlearning the habits that you've become so used to, unlearning this mechanism that has gotten you through so much, unlearning this lifestyle that you have adopted for so long. And the best way to do that is usually therapy, so that you can work through the problems or the life experiences that have led you to use this as a mechanism, and slowly progress towards eating healthily again. So certain eating plans and maybe certain calming statements that can help you when, for example, the voice that people who have an eating disorder describe, how to quiet that down a little bit. As Kazi mentioned, there is a weird line between forcing and not forcing. So I also know people who have eating disorders, and they've described to me that my first impulse when I found out that they had an eating disorder was I listened and everything, but after a while, when I could see that there wasn't really necessarily any change, I started asking them what they're eating. Every day I would ask, have you eaten? And that comes from a good place, that comes with a good intention, because you are worried and you're concerned and you want them to eat the healthy amount. But they said that doesn't help them, that actually made them lie to me more, and they didn't like doing that in the first place. It's the forcing is if you constantly ask them what they're eating, they also feel like they have to be more secretive, and they might like the girl that I described earlier who shared her story about anorexia. When her parents started forcing her to eat more or regulating her food more, she actually became more secretive and started making stricter rules for her food intake. So it's confusing. It's because obviously, if they get to the point where they're not eating enough and you can see it, eventually you might have to force them to eat because otherwise they will.
I mean, yeah, that's what happens in a hospital as
Yeah.
well. That's what hospital staff does as well. They're going to offer you therapy and they're going to be talking and they're going to offer you some kind of cognitive help. But if you're not eating after a point, even in hospital wards, they'll give you a drip, which most patients might take out sometimes.
Yeah.
But if you're not eating, they will force feed you.
I mean,
in,
they
in
have no
hospitals.
choice because
They have no choice because if you're like passing out and you're at the
Yeah.
point of dying, they will force feed you.
Yeah.
And you don't want it to reach that point.
Yeah.
Because as a friend or someone, you don't want it to reach the point where you're literally sending someone to get force fed.
Yeah.
But that's what I mean when I say, and obviously being force fed would be a traumatic experience for
Yeah.
anyone.
Yeah.
But over there, we're seeing it's more important to keep them alive than
Yeah.
to look at if
They're comfortable or
they're
not.
comfortable or not. Unfortunately, there's no
Yeah.
better way of saying that.
Yeah.
And then that's just how it is sometimes.
That's unfortunately just how it is, and you have to be patient and you have to be supportive and you have to let them know that you're there and and you care about them, and that's really all you can do, really.
It works in other ways too. Like, for example, for morbidly obese people, when they've gone to therapy or when they've had talks and there isn't any improvement being seen, sometimes in the hospital they'll be kept in a separate ward and they just won't be allowed to eat. So when we're getting to a point where professionals have to step in
Yeah.
and do the worst,
Yeah.
I think then you need to realize, okay, yeah, you need to step it up. And also, of course, your comfort is important, but you also need to realize that your comfort zone is the eating disorder.
Yeah.
What
Yeah.
you need to realize is that of course it's going to be uncomfortable because not having an eating disorder itself is uncomfortable.
Yeah.
So no matter what someone is going to say to you or how it's approaching or how you're being approached, not having an eating disorder is what is uncomfortable. At least in my opinion, I don't think saying to someone, what are you eating today, or what's going on with you, I don't think the place of discomfort is coming from the fact that your friend is asking you that. The discomfort is coming from the fact that the eating disorder is your comfort zone.
Yeah.
And when you're being shifted and when they're trying to shift you out of that comfort zone, no matter what they're trying to say, it's
Yeah.
going to be uncomfortable for you.
Yeah.
That's true with almost any psychological issue. Yes, you need to look at how much, of course, something is comfortable to you, but you also need to look at how am I genuinely going to get help.
Yeah.
Sometimes you need a bigger push to get help. Sometimes when you're in your comfort zone so much, you need someone to be like, what is this? What is going on? What
Yeah.
is happening? What am I eating? What am I not eating?
Yeah.
So you also need to be aware of, is your comfort zone actually the place which is
Good for you.
good for you? Maybe that comfort zone isn't the place which is good for you.
Yeah.
And of course it'll be hard and it'll be traumatic and it'll hurt, but it's better than facing the consequences of those things.
Yeah. Yeah, exactly. And I think that's it for today. If you or you think any of your loved ones might identify with some of the symptoms that we've talked about or some of the feelings that we've talked about, it may be a cause of concern, and we strongly suggest seeking professional help. Even if you don't identify with all of what we've talked about, you should still seek help, because even if you're engaging in any of these behaviors to a moderate level, they can increase in severity, and anyways it's a cause of concern because there's this is not a healthy coping mechanism and there are issues that need to be dealt with. So we'd strongly suggest that you seek professional help before it gets to a much worse condition. And yeah, that's it. See you guys next week.